Hyperparathyroidism. Hyperparathyroidism is a condition in which one or more parathyroid glands become overactive and release or secrete too much parathyroid hormone, that is PTH. This causes the levels of calcium in your blood to rise, a condition known as hypercalcemia. Characteristics: parathormone excess may be primary, secondary, or tertiary. Primary hyperparathyroidism (HPT) is most common, characteristically occurring in women with a ratio of 3 to 1 over 50. A single adenoma accounts for more than 90% of all cases. Carcinoma is rare, that is 1%. Parathyroid hyperplasia usually occurs in multiple endocrine neoplasia syndromes. Continuous stimulation of the parathyroid gland can result in adenoma formation and autonomous secretion of parathormone. This is known as tertiary hyperparathyroidism. Secondary hyperparathyroidism results secondary to prolonged hypercalcemia. Calcium levels are normalized at the expense of bone turnover, associated with chronic renal failure, osteomalacia, and malabsorption states. Clinical features: asymptomatic and only diagnosed from biochemical test. Features related to hypercalcemia: suspect in patient presenting renal colic, as 20% of recurrent stone formers have HPT. Polydipsia, polyuria, lethargy, somnolence, confusion, and depression are common. Causes: anorexia, nausea, constipation, and even peptic ulceration. Radiological features: subperiosteal bone resorption, seen lace-like pattern, occurs along the bony cortex. The earliest changes are seen at the phalangeal tufts and radial aspect of the middle phalanx of the index and middle fingers, clavicles, and proximal humerus. Bone softening results in vertebral wedging and browning of long bones. Brown tumors: these are localized replacement of bone by vascular fibrous tissue secondary to the action of osteoclasts. Commonest in the jaw, pelvis, and rib. Soft tissue calcification, commonly with secondary HPT, result in chondrocalcinosis of hyaline and fibrous cartilage, that is wrist, knee, menisci, shoulder, and hip. Osteosclerosis, commonly in secondary HPT, predilection for the axial skeleton, rugged jersey spine due to vertebral and plate sclerosis. Periosteal newborn formation. Subperiosteal resorption, this is the X-ray of the hand. And here is the X-ray of brown tumors in secondary hyperparathyroidism. The arrows show the location of the brown tumors. And here is the X-ray of the brown tumors in pelvic region. And here is the X-ray of chondrocalcinosis, that is intercarpal and metacarpophalangeal joints. Here is the X-ray of rugged jersey spine. Management. In the acute setting, management is directed towards rehydration. In the very sick, forced diuresis, steroids, and hemodialysis have been used. Bisphosphonates require 2 to 3 days for onset of action. Treat the cause. Ultrasound and systemic isotope scans are used to locate the adenoma. Parathyroidectomy indicated after useful consideration. Thank you.